I'm Dr. Tamara Griffiths, a consultant dermatologist. I trained both in the US and here in the UK, and I'm currently working at Salford Royal Hospital and also hold a post as honorary lecturer at the University of Manchester, where I had the clinical research in aesthetic or cosmetic medicine and dermatology. As a consultant dermatologist, I'm an expert in conditions relating to the skin, hair, and nails, so any kind of skin disease or skin condition. But going on from that, there's a big overlap in dermatology with the cosmetic sector. So when we talk about the aesthetic arena with non-surgical procedures such as dermal fillers and wrinkle relaxing or muscle relaxing treatments, I can offer a high degree of expertise. When patients come in to see me, sometimes they don't know exactly what it is that they need. They have an idea in their head, but because they don't have all the information, know the breadth of treatments available, they might be fixated on a certain aspect. So what I can offer them is a very broad approach with a broad range of knowledge as well as an intense depth of knowledge. So I can assess their face, and aging is not just about skin, it's skin, subcutaneous fat, muscle, and even bony changes underneath, and how all those anatomical levels work synergistically to create sort of an older appearance. So I'm able to assess very holistically facial aging to suggest solutions that the patient may not have thought about, which actually would have a bigger impact than what they're fixated on. The patient journey is absolutely tailored to the particular situation and to the individual patient. So the initial step is to come in, have a consultation with myself, and we can talk about whatever issues are troubling the patient with regards to rejuvenation or with any other skin complaints. We can address those, and then if the patient is keen to proceed with the treatment, we can progress, or they can always come back. There's no pressure to do treatments on the day at all, but if it's more convenient for the patient, depending on my clinical judgment, that's possible. The patient comes back and we go through the consent and make sure all questions are answered, and then we would do the treatment depending on what it is, and proceed as needed. So some injectable treatments need top-ups every 3 to 4 months, other ones are only once or twice a year. So it really is depending on what the patient's needs are and the treatments involved. The first step for any patient is to come in for an initial consultation. I'd be more than happy to see them anytime, so they just need to get a hold of the clinic to book in with me.